Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode. In the studio with me is Dr. Ashley Ackerman. Welcome back, Dr. Ashley.
Thank you. How are you this morning?
I'm doing okay. We were worried about you. You know, I told the audience last recording I enlisted Super Sandy to help me out with the episode. Explained to the audience that you were playing hooky, you were on vacation.
Don't listen to him, by the way. Do not listen. It's not true.
Listening to music that was, very hard driving. Full of
energetic,
lyrics.
you mean?
Energetic, right?
Yes.
Lyrics I could not readily understand.
Oh, gosh.
But anyway, I'm glad you're back. Glad you had a good time.
Thank you.
And audience, we are glad to talk to you in today's episodes about, our three agencies, Appleseed, Catholic Charities, and CADA. We've been going through three great programs, Dr. Ashley, for the last few times, but we wanted to talk about a program or programs that all of our agencies share to some extent, which are clinical services at our agencies. And what I mean by that is services like counseling and assessment and case management and psychiatric services. So I would say when people think about our agencies, this is probably the kinds of services and programs they think of most.
Probably, yeah.
Mm-hmm. So, you go to Appleseed, Catholic Charities, or CADA because you need an assessment and you need counseling. So, but I have found, Dr. Ashley, over the years, you and I are both counselors. We've done all the things we're going to talk about, but I don't think most people have a good idea of what actually we mean by these services.
That's fair. I would say probably not. Yeah.
So I thought it'd make sense to just unpack the services, where they're at. And like I said, sometimes all three of our agencies offer these services. Sometimes they're special to a particular agency. And when that's the case, we'll point that out. But maybe start by saying the most common first step for folks, and I say this because our goal is for folks that need help. We want to make that easy for folks to access and understand. I just really am a strong believer. Maybe it's because of my own issues, Dr. Ashley, but informed consent is really important to me. And what I mean by that, audience, is before you go somewhere, you should have a good idea of what's going to happen.
Yeah.
I get anxious when I walk into a situation that's new and I've got no clue what's going to happen.
Absolutely.
Some people find that stimulating, exhilarating. I do not.
No, thanks. I'm
right?
the same.
I want a rough idea about what is going to happen. So one of the first things that happens when you go to a CADA, Catholic Charities, or Appleseed is an assessment. Mm-hmm. Now, that sounds maybe intimidating to people, but and we're going to try to use just common terms. What we mean by that is the person, usually one person, will talk with you, and I encourage people to bring your loved one or your support person because they're going to be asking you about what's going on in your life that has caused you to get to the point where you feel like you need help. Mm-hmm. So maybe you've tried family, friends, church, other support people in the community, but whatever you're struggling with, whether that's feeling down or blue or anxious or you name it, whatever's going on has reached a point where you feel like everything you've been trying hasn't worked, and what I mean by that, you're not feeling the way you want to feel.
Right.
So the assessor is trying to determine, just like with a medical appointment, what's going on, get to know you a little bit, but figure out what's going on, when it started, when things got to a point where, you were really upset or it was really interfering with your ability to work or raise a family, et cetera. So they're going to ask a series of questions. And for the most part, the forms that they use to guide them through that process are standardized.
Yeah.
And that's just a fancy word meaning everybody kind of gets the same questions because these are questions that, generally speaking, help the assessor figure out what's going on.
Yeah.
So they're listening, I think, Dr. Ashley, for certain words, phrases, situations to help give them an idea. So just like when you go to a physical doctor, you're talking about your foot, your head, your arm, your shoulder, your heart, your breathing. So they're trying to narrow down to some extent what might be going on. So the questions you're going to be asked are very similar to when you go to see your general practitioner. Does it hurt here? Does it hurt
Right.
here? Right?
Yeah.
So they're going to ask you questions that really are along those lines.
Yeah, I think the word assessment can be intimidating.
Yeah.
If you just think, assess the situation, I think that's a good way of thinking about it. They're trying to understand. If they don't have all of that information, how can they help, right?
Yep.
So it's an important step.
Yep. So my encouragement to you all that are seeking services is to be as honest, blunt, as possible, as clear as you possibly can be to the questions that are asked to you, because that helps the person get a better understanding and quicker. The quicker you can be honest and frank and open and clear with what's going on.
Yeah, I like what you said, too, about bringing a loved one if you want. If there's someone you trust, of course.
Right.
And someone you're close to, because there are a lot of questions that can be kind of overwhelming. And sometimes you kind of forget things, too. They're asking a lot of questions. So that can help sometimes if someone's there to support you and
Agreed.
help. Yeah.
So the whole purpose, though, of an assessment is for the individual and then the organization to figure out, is this the best place?
Yeah.
Can we help you? Right? I've been to doctors before where after going through the assessment, they said, oh, I'm going to have to refer you to a specialist, right? Because what you're describing isn't something I can help you with. So keep that in mind. I think sometimes people feel like if I go to one of these agencies, they should be able to help me with anything I say. And that may not be the case.
Right.
It might require a referral, or maybe they can help you with some of it, but not all of it. But that's what they're trying to determine. And if I would just say, if an agency says they can't, then try not to be too disappointed. I understand some folks may be disappointed, but you don't want them to try to help you if they really don't feel like they have the abilities of the school, the tools, the skills, et cetera, to do so.
They should not be trying to do something beyond their scope of practice. So
when I get referred off to a specialist, I understand it's an extra appointment. I have to tell my story over again, so that's a little annoying. But I sometimes feel better too, knowing that whoever they're sending me to, this is what they're good at.
Absolutely.
So just keep that in mind. So the whole point, though, of an assessment is to determine that, and then the next step usually is to refer you to additional services. So I would say that formal assessment usually only happens once, maybe twice when you go to an agency.
Yeah.
And then they refer you on to what we call ongoing clinical services. And a lot of times that's counseling, and that could be done either individually or in a group format. Usually it's individual.
Yeah.
So this is, I think, what most people think of when they think of our agencies and what they've seen on TV and, and sitcoms and other things where somebody comes in and they talk to a counselor.
Talk therapy.
Therapy. So this is the maybe the heart of our agencies is the talk therapy, and the rationale, the science, if you will, behind talk therapy is by your counselor listening to what's going on, and based on their specialized training, their knowledge, their experiences, they're supposed to walk beside you, offer you suggestions, tools, resources, listen first and foremost, but in addition to listening and better understanding what's going on for you, to hopefully offer you help in a variety of different ways that might help you achieve the goals that you're there for.
I love that. Yeah. And the counseling relationship, we talk about that a lot. That's very, very important. I think it's more important than...
Why does relationship matter, Dr. Ashley?
It does. It does. Human connection, right? A lot of times that's what we need when we're suffering. We need support. We need connection. And a counselor is a form of that.
Yeah. So somebody who understands, somebody that you feel like can connect to you because you might be going through one of the more difficult times in your life. Yeah. So somebody that could connect to you in that you feel connected to. And I think you hit on something there, Dr. Ashley, I wanted to cover. So, I as a counselor before, I did my best to try to connect as best as I knew how with everybody I saw. But guess what, Dr. Ashley?
Not everyone connected with you.
Can you believe that? Some people did not care for me.
Oh, that's sad.
So one of the things I told them from the very get-go, I thought so. I told them, Dr. Ashley, if, give me a couple sessions. If it doesn't seem like we're connecting, please tell me that.
Right.
And I will refer you to somebody else because, let's face it, sometimes it's a gender thing. Sometimes it's an age thing. Sometimes it's an experience thing, right? So I remember seeing an older adult who just said, Sonny, you just You're too young, right?
I had that same experience.
Okay.
Yeah.
And quite frankly, I don't feel equipped to counsel women or particularly mothers. And they say, how many kids have you had? And I have to say none. So again, that I say that to the audience to say all of our agencies know this.
Yeah.
We all operate this way. It's our responsibility to get you to somebody at that agency that you feel connected to. Because until that relationship gets set, counseling can't really be that effective. I'm not saying it won't be effective at all, but it's certainly not going to be as effective as it can be if you're not with a counselor that you trust, feel like you're connecting with, you have a relationship with. So we want you to have that. So don't be afraid. Don't be hesitant. Give the person a few times. But if you really feel like, man, we are just not connected and I just don't see myself talking to you about my deepest, darkest, I need somebody else. Who else here at the agency can you recommend?
Absolutely. Think of it like when you go to a primary care doctor, family doctor. If you're not syncing with them, it's not working, you will go look for another doctor. But for some reason, people think about counseling differently, I think. It's like they're afraid to offend the counselor or something. But really, we know that as counselors. We know that not everyone is going to vibe the same. And we encourage people to advocate for a different counselor if they need it, even if it means not seeing us.
That's right.
Yeah.
Right. Well said. I will say, don't feel bad because there are plenty of folks that are seeking services. So if I don't click with somebody else will be, scheduled with me. So it's okay. You're not going to hurt our feelings, as Dr. Ashley said. We understand this is part of the work we do. So another service that is very common in our system is something called case management. Now there's fancier terms, for case management, but essentially a case manager isn't a counselor. But they do help the person achieve their goals. Oftentimes, they're more involved with the day-to-day practical stuff that the person might be struggling with. It could be housing, transportation, food. It could be accessing services. But it could be not knowing some of the resources in town. We always talk about our parks, and I always like case management because you can be a little bit more experiential. You can be out with the person. Doesn't have to be as office-based. Counseling tends to be more office-based.
True.
Case management doesn't have to be. So the person maybe is in the home, out with the person in public at various places where it makes sense. You're actually, this is a kind of a loaded term, but you're doing life with the person. You're actually walking beside them, literally, helping them with some of the skills and the tools that would be helpful to them reaching their goals. Yeah,
I always really liked that as a counselor. So my clients would see case managers, and they would actually be practicing the things we're talking about in counseling, but in real life. So I think that's an important component too.
Yeah, so it's important to know all of our agencies do assessment, all of our agencies do counseling, all of our agencies do case management. And again, that could be done individually or in a group. Now, this next service is called Crisis. We've talked to it specifically on the podcast before, so I won't go too deep into it, except that it is very important because it is 24/7. Appleseed's 24/7 crisis line is the primary mechanism that folks utilize when they're in crisis. But I don't want to forget about ACADA because there are substance use specialists of our three agencies. And I always recommend if folks are really experiencing a substance use crisis, they can contact, the 24/7 crisis line, or if it's during normal business hours, just contact Rick over at ACADA because Rick knows the substance use agencies, like for withdrawal management, detox, or residential. There's certain regional funds that exist or funding that exists to get into those because they're very expensive. And he knows which ones are of higher quality and lower quality and what their availability is. So I always tell folks, don't do crisis on your own. If you're experiencing a crisis, you or a family or loved one, call the 24/7 number. We talk about that at the in the podcast, in the opening and the closing, but it's the 419-289-6111 24/7. So crisis services primarily through Appleseed, but also through ACADA.
Yeah, absolutely. I feel like, so if you are struggling with mental health related things, relational things, substance use, those are, if you're struggling and you're overwhelmed, that's when you should call that line, right? If you need some support.
Yep. And sometimes people call for information and education and resources.
Yes.
That is fine too.
Good point.
This next service, psychiatric and nursing services, now that's a little unique to Appleseed. I wouldn't say our other agencies do that. Not, most longtime listeners to the Keeping Ashland Healthy podcast know that the board's not huge pushers of psychiatric medications, but we're not against them entirely, but we just think that they really need to be thoughtful. How are they really going to be helpful to the person achieving the goals that they have? And, for how long, doses being, if they're going to be used, shortest time, minimal doses, what we call medication optimization principles. But psychiatric services does involve, a psychiatrist at Appleseed. They've got a couple on staff, and they will add, I like to think of it as, we talk about medication-assisted treatment. I apply that to the world of substance use as well as mental health. So, audience, think of it this way. If psychiatric medications are utilized, think of them as assisting your treatment, because we do not like to see medications as a treatment in and of themselves. So again, it's a crude way to say it, but a pill's not going to make your relationship skills get better.
Yes. You took the words right from my mouth, actually. I love that. Yes.
Yeah, medications don't help you, be a better employee per se, or a better student. They may help with some of the symptoms in the short term, but there are still skills. There are things going on beyond the symptoms that you might be experiencing that still need to be discussed with the counselor.
Yeah. So you can't just take a pill and fix everything, right? So I like that. Medicine in addition to the treatment.
Right.
The counseling, that's important.
Yeah, but the treatment is the counseling. It's the case management. It's not the pill.
Right.
But the pill might make that easier or more likely to be successful. But I would, again, inform yourself. There's plenty of places to inform yourself about the psychiatric medications, the effects of those, taking those.
Yeah.
So just be very, very, I think, careful and thoughtful before starting those, and have that discussion with your team. That's something we haven't really talked about. If somebody gets an assessment and then they start seeing a counselor, maybe they also have a case manager. Basically, they have a team, and it's okay to have what we call a team meeting.
Yeah.
And a team meeting is basically you meeting with everybody that's part of your team there at the agency. Those can be helpful to say, I feel like I'm stuck. We're doing this, we're doing that, but I still feel stuck when it comes to my goals. What can we do differently as a team?
Yeah, that's a great idea.
Yeah. Sometimes the counselor or case manager will want that. Sometimes the client wants that.
Yeah.
And that either way is fine.
Yeah, good idea.
So psychiatric nursing services, as far as our three agencies, that's primarily focused just at Appleseed. Another kind of specialized service that folks might be referred to would be peer support services, and that's primarily at Acada and Catholic Charities. And I just want to talk through that with you, Ashley, because that's newer. We haven't always had peer support services.
Yeah, there's a lot more peer supporters now.
Right. Ohio is really big on this. They've been promoting it, trainings, and the certification.
Yeah.
A lot of our audience might be familiar with Pathways. That is a peer recovery center that has peer recovery workers at it. I know that's something that they want to grow. They're in the process of doing that. Folks come there, and the whole idea is it's kind of like what it sounds. Some people benefit by the counselor, case manager, but sometimes if you add a peer person, somebody who's been through similar life experiences that's been trained to help folks, again, similar to case management, not exactly the same, but it's really leveraging their experiences as somebody's gone through similar things.
Yeah.
So the thinking is, if you've gone through similar things successfully, you might be able to give back and help support somebody that might be going through things that are similar to what you were able to overcome.
Yeah, I think it's just a different level of understanding. If someone's gone through it, they have something different to offer, and also they're modeling, their own success story. They've gone through it. They've navigated whatever the issue is, and they can help someone else get through too. So peer support's unique.
Yeah. So at Acada, for example, the peer supporter, Lori, she works with individuals primarily in Acada's recovery housing. And again, Lori's been in recovery successfully for years, and she's able to help folks that are at an earlier stage in their recovery and helps them with individual things, group things, practical things, you name it. Lori again, leverages her success and her story to help others. And everybody that works with Lori, I think, loves her.
She's great.
Yeah. And similar at Catholic Charities with Pathways programs, those peers are working really hard with the participants down there to say, listen, it might seem difficult, challenging, but, I was there. I had a very similar experience. This is what helped me. Maybe it'll help you.
Yeah. And those, again, connections are really important. Just having the connect to those people when you need some help. Yeah.
Well, a question that people might have that I wanted to talk about before we start to wrap up is how long does this counseling stuff take, Dr. Ashley? Is it years and years and years?
I'm just going to say it shouldn't be.
It should not be.
It should not
Dr.
be.
Ashley.
Yeah.
What should folks expect?
So maybe you take the lead on this. What should they expect? I don't think it's a lifelong process, right? Yeah. You should be goal oriented, working towards your goals, and however long that takes you personally to achieve that. But we don't want people in counseling forever.
Yeah, I agree. There's going to be some variableness because we're all different as human beings, right? But I think you're wise in saying from the get-go, Ashley, Dr. Ashley, sorry.
You don't have to call me Dr. Ashley.
Sorry. On the program, we have to. No. So, but when you start this, either you or a loved one, Dr. Ashley's right. I mean, this is not a forever relationship. It's an important relationship, but you should have clear goals that you're trying to attain. And you need to be clear, both you and your team need to be clear, like, if these things are happening or not happening, that means I've reached my goal.
Yes.
So very specific, sometimes they call them SMART goals, smart, achievable, realistic,
measurable,
timeliness.
Yeah.
So the goals need to be really specific so that everybody knows, like, if this happens, then I think I'm good to go, Doc.
Yeah.
So, and I think it does vary, but you're right. If things are not getting better within 3 to 6 months, maybe course correct. Mm-hmm. Things should start to happen. Some noticeable changes should start to happen. I say that because I don't want the audience, because I know a lot of people have watched a lot of bad TV and bad sitcoms.
There are a lot of things out there,
and again, and to be perfectly honest, our profession isn't always as effective as it is, and it almost, depending on where you go. I'm not talking about our 3 agencies now, but some agencies maybe don't instill the sense of that we're going to get through this, we're going to help you do that, and that's going to happen rapidly. Mm-hmm. And they may even foster the idea that, hey, no hurry. Mm-hmm. Don't worry about it. It takes as long as it takes.
Yeah.
One of the old expressions, Dr. Ashley's, well, it took many years for you to get to this point, and it'll probably take many years to get out of it.
I dislike that.
Really? That's not logical?
Red flag.
Red flag. So that is not logical, audience.
Yeah.
No, just because it might have taken a lot of time for something to happen doesn't necessarily mean it's going to take an equal amount of time for it to be undone.
Yeah. When I was doing counseling, we don't do that anymore. But when I was doing that, I was always happy when clients would move on and they wouldn't need counseling anymore. Like, my goal is for you to not need me. Yep. I'm trying to teach you things, give you the skills you need so you can do that on your own.
I know.
That's success.
It's one of the few professions where we love being fired.
Yeah.
It is great. Like, people are like, I don't need you anymore, David.
Like, that's wonderful. Yes. Yeah. I love that.
So I'm glad we talked about this today, Dr. Ashley, because, I just don't want people to be intimidated about getting help when they need it. Yeah. But I also don't want them coming into the process with expectations that are wildly different than what they're going to experience, because that's when I think people get upset and like, I didn't know that was going to happen. Why'd they do that? Why'd they do this? Why didn't they do this? And then they get upset, and then they're suffering alone, maybe, or suffering unnecessarily. So I hope today's episode helps folks have a better sense of counseling, case management, psychiatric services, crisis services, peer services, how to access those. They can get most of these services at all 3 of our agencies, Appleseed, Catholic Charities, and Acada.
I hope so, too. That was well said.
Well, thank you, Dr. Ashley. And until next time, we will continue to do our best to keep Ashland healthy through our work here at the board. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.